Forehead lift surgery is mostly performed in very advanced ages. It is a method we apply to patients who have too many wrinkles in the forehead area or a very significant drooping of the eyebrows. We can perform forehead lifts using two main methods. The first is endoscopic. The other method is forehead lift surgeries performed with the open classic method. Both techniques require general anesthesia in an operating room setting, and that is the best practice. On average, while the surgery duration in the endoscopic method is around 2 hours, in the open method, meaning the classic method, the average surgery time is around 1 to 1.5 hours. In both techniques, the patient goes home the same day or the next. The basic recovery time is 7 to 10 days. If there is swelling, the time for the bruises to disappear is on average 7 to 10 days. And at the end of these 10 days, the patient returns to their social or work life, can return. Naturally, there are certain key details that must be observed during the operation, irrespective of the chosen technique. Among these key points is the necessity of avoiding excessive elevation of the inner sections of our eyebrows. This is extremely important because if the middle parts of the eyebrows are lifted too much, it causes a surprised expression in the patient. It is essential to elevate and tighten these specific areas only to the extent that is absolutely necessary. However, as you move towards the outer part of the eyebrow, you need to increase the lifting effect, the stretching effect, a bit more in the forehead area. Since the entire surgery, whether endoscopic or classic, will be performed from within the scalp, there will be no issues regarding scarring. And especially after the surgery, the time required for the operation to settle is approximately 3 to 4 weeks, and at the end of this period, we can truly have a very natural, very rested, we can have a very youthful expression.